So how are you, G?
What's up, Ruse?
What's going on?
I'm good. How are you doing?
Good, man. Good.
Yeah.
Did you find the place okay?
Yeah.
Good.
Absolutely.
Good parking.
I wasn't driving. I don't drive out here.
Okay, cool.
So always good.
So let's talk about what we want to talk about today.
Okay.
I decided to have this podcast
All right.
for many reasons.
Mm-hmm.
The number one reason I think is you have such an interesting story as a former basketball player, American football player, as a personal trainer, as a life coach, in my opinion, as a psychologist, as a good friend, a dear friend, as a brother. So many titles, and that's what we're going to talk about. And to be honest with you, for the past 4 years, you've been a big advocate of my of my personality, of my career as a therapist, and so many other things.
All right.
And recently, I've noticed that we have such good conversations.
We do.
as we are doing your treatments at the clinic Beyond Rehab.
Yeah.
And every time you come by, you have such a great insight and overviews towards life, towards rehab, sports injuries, and so many other things. And I thought to myself, if we're not recording this, we're just really wasting some good energy. And I think if it's interesting to us,
Yeah.
it's going to be interesting to a lot of people.
Yeah.
And even if they're not interested, I
Right.
think it's going to be cool for us to learn more about each other and about our experience and about our journey.
Right.
So anyway, that was just a little introduction of
Right.
why we're having this podcast. It's not really towards any kind of marketing purposes, I think. It could be used as that.
Right.
And we're going to be as interesting and exciting as we can. And that's it. I think let's go through that, and then I want to
Sure.
hear your side, why you accepted to do this podcast. Number one, because I know you're very close with your community in terms of like if you're going to produce any kind of content like this. I know you're very picky and specific about the people that you interact with. And the fact that you accepted this invitation from my side, it's honestly a blessing. It's a true honor and a privilege to have you in this day, and love to hear your side. Why did you accept this, this conversation?
It's simple as you're my friend, Ruse. And there's nothing I'd like more than having a conversation with a friend. Obviously, you've been my therapist when it comes to the injuries that I've sustained in the last few years. And along the lines, we've curated a beautiful friendship. So I no longer think of you as a healthcare provider or a therapist. I go to your clinic, Beyond Rehab, which is congratulations. That's a big milestone. It's huge.
Thanks.
I'm very proud of you. I'm very happy that you took that initiative. I think the city needs very good or excellent healthcare providers for it to keep developing and keep creating a better environment for athletes in terms of recovery, in terms of rehabilitation, in terms of performance, etc. I've accepted this invitation because you're my friend, and I'm never getting tired of having conversations with people that I hold dearly to my heart. It's something that I enjoy doing, and if this serves as, just like you said, it's a conversation. It has no agenda for the first time. I like things that have no agendas.
Perfect.
Especially in a world where everything's so saturated with marketing. Everybody has something to say, which is fine and dandy, but I think natural conversations that specifically don't have an agenda, there's nothing to be pushed. That's something that kind of pushed me over the edge and said, you know what, I would love to have that recorded and see how it actually turns out.
Exactly. So we did have a quick conversation regarding some of these events which are going to take place, and the the topics that I want to cover for today, it's actually some of my questions, and then hopefully you might have some questions from those questions, and I think we can have a nice conversations from all of those. I think the best topic, the first thing that I want to ask you is, give me a little introduction about G.
Okay.
About Gaffar Elsouri, a former basketball player. Mostly, I want to know what happened exactly with your. How did you get into pro basketball, and how did you play American football?
Right.
And that's a really interesting story. So you don't really see that combination, except for LeBron James, you know. So you hear that, but it's in America and Canada. I think that's very unique and specific for someone to just either go from football to basketball. I think you went from basketball to football and then basketball again, something like that.
I've played both at one point. It was I was a two-way athlete or a two-sport athlete. Well, basketball has always been everything that I've ever wanted to do. It's a sport that I fell in love with. I found myself in. I grew up in Saudi Arabia, where basketball, as most of the Arab world, it would be a secondary sport, so to speak. Obviously, things have changed. The times have changed. There's a lot more care right now. You can see in Dubai, it's booming. There are different leagues that are creating a space and an environment for young athletes and older athletes to kind of compete and have fun. But back in the day, the Middle East was not really known for basketball. I had a neighbor of mine that used to go to the States every year. And he'd come back with, I don't know if you remember the VHS tapes.
Of course, man.
So he would come back with the NBA inside stuff and whatnot.
Yeah.
And this one time I was watching it, and I'm like,
What year is that?
Now you're going to have me show my age.
1989?
No, that was around, I would say 95, 96.
Yeah.
95, 96. It became, an obsession of mine. Went to try out for the junior high school team, if you want to call it. We called it 7th grade. And my coach said, or the coach that is responsible for basketball, he's Egyptian. I don't know if he's dead or alive, but if he's alive, I hope he's well and doing his thing, because he instilled the love of the sport for me. So I went out there, and he told me I was probably the worst thing that he's ever seen on a basketball court.
No way.
So kind of pushed me to create a voice for myself, personality, so to speak. I became obsessed with the sport, fell in love with the dynamics of movement. It has a lot of jumping, so that's where I found my joy. And before you knew it, it was everything that I've ever thought about. At one point, I said, I want to do something with this sport, and the only way for me to do that is to go to the West. So right before my 11th grade, I think this was the year 2000 or 2001. 2000. Can't remember, one of them. Long story short, I went up and I was in 5-star basketball camp, which is the most elite camp in America at the time. Still is. Rest in peace to Garfinkel, who was the owner and creator of that camp. He's seen everybody from Michael to anyone that you could name from the NBA. Went out there. I was in the States. I did really well. I got a standing ovation from the owner of the camp, and it kind of gave me that drive. I got that standing ovation, got nominated for the All-Star team. That's the year they discovered all the big names: Sebastian Telfair, Shannon Brown, LeBron James. Everybody was out there. We were young, obviously, kids. And I thought I had a pretty good chance in hanging with the people.
Making it into the NBA.
Well,
maybe?
The dream was any kid will always dream about making
The
it to
highest
the NBA,
level.
the highest level. But to me, it was just a moment of where I saw something that said, you know what? This love of mine for this sport could be something that I could carry on for the rest of my life and do something with it. Came back, September 11th stuff happened, I believe, that summer. Just, I think 3 weeks after I came back from the States. And it kind of, rocked the boat a little bit in terms of the direction that I wanted to go and whatnot. But thankfully, it all worked out. There were enough coaches and scouts at that camp that saw me play. So I got an opportunity, and I took it.
Right.
And, within 2 to 3, I went to university, did my thing, and then midway, American football kind of fascinated me just because it's really athletic.
Mm-hmm.
It really hinges on your physical dominance.
Right.
Luckily, I've been blessed to be a very, very, very fast player or athlete. And during a summer run, while we were just scrimmaging the guys and whatnot, and whoever's on campus, one of the football coaches came around. He said, "Have you ever thought about playing football?" I said, "No, I play Madden most of the time with the guys, and I'm pretty good at that."
Exactly.
So he said, "Just give me a summer of your life. I'll turn this around." And I said, "Okay." So I stayed on campus that summer. I didn't go back home, and worked my tail off in the gym. And that's when I sort of started seeing the bridge in athletic performance, where everything I did in the weight room, and specifically in the way that you train, plyometric training to rate of force production, to resistance training, to anything you can name of, all the modalities, it all translated to me being a much more explosive basketball player first. But the grind and the enjoyment and the camaraderie of being in a weight room with the other athletes, and the competition that it kind of brings out of you, it made me appreciate what performance training looks like. So football became a thing for me. I played it for 2 years. I was the corner. I played cornerback, which is on defense.
Of course.
You like to hit people a little bit.
Yeah.
I was on special teams, on punt return, kickoff return. And occasionally I played a little bit of receiver in certain...
This is in Canada.
Yeah.
Got it.
And yeah, I became, at one point, I was one of either the only one, or there were two other dudes that we were the only two sport athletes in the Atlantic Conference.
Right.
And I appreciated that. Like that, I kind of saw how it transitioned. It explored different sides of me, the aggressive part when it comes to play, and how to channel it correctly on the field. And at the same time, on a basketball court, it added the ability for me to kind of get hit, let's say if I'm driving, or to finish strong at the rim, so on and so forth. So it's kind of like it became I saw that it was really compatible.
Right. So this is really interesting to me as a physician, sports rehab physician, I would say, because again, for those who don't have an understanding of what I do for a living, a lot of people say I have a doctorate degree in chiropractic. Right. And unfortunately, people miss the fact that I have a degree in physiotherapy and sports medicine. And the reason so this has made this really interesting way of looking at different athletes and non-athletes, pro athletes, semi-pro athletes as well, to have an understanding of, okay, this is really interesting how basketball and American football that are very different, because almost like American football seems to me that is a combination of 3 different sports.
Yes.
Right? So you have track and field.
100%.
Okay. You have a little bit of MMA in there.
Definitely.
So a lot of knee locks, a lot of wrist locks, a lot of triangles, all those things. And you also have a lot of like strength training. Okay. So almost
significant amount.
Right? So you have to be a perfect athlete.
Yes.
A complete athlete to play American football.
Yes.
Now, my question is always this: if you are involved with American football, so basketball to American football, then you go back to basketball. The part that is really interesting to me, and for this podcast, I would say, how would you describe the physical load on joints and muscles and tendons as a person who played these two sports together? Would you say that made you a better athlete? Or would you say that it put you at a vulnerable state in terms of you took a big load on your body and for switching to American football and coming back to basketball? Or would you say that actually made you a better basketball player when you came back to it?
Yeah, no, I think to me, it made me definitely a better athlete.
Mm-hmm.
Was it taxing on the body, on the joints?
Mm-hmm.
Yes. I think basketball is a lot more taxing on the joints than American football.
Mm-hmm.
Because in American football, unless you're playing on special teams,
Mm-hmm.
you have to be either on offense or defense.
Got it.
And it happens in spurts. A play can go between a 10-second play to probably if we have a run, or
Mm-hmm.
it could range to about a minute max. That's me being very, very gracious with the
Yeah,
timing.
yeah, yeah.
Basketball, no. Basketball is on all the 48
you're-
minutes. You're going at it. You're going from offense to defense. You're
Mhm.
reacting. You're producing violent forces on your joints. You're going from let's say a zone 3 with your heart rate to zone 5 within a second. That's where there's a little bit of commonality in football, because once they go hut, you need to produce 110%
Sure.
energy. Basketball, you can go back and forth, but it's a lot more taxing on the body. I found it. The thing that I found that helped me was the aggression of football and the ability to play post a hit, or you being tackled and you have to get up again.
Like a direct trauma,
Yeah,
direct contact.
yeah. It served the purpose for me in basketball, because basketball is not as, it's a contact sport. Football is a collision sport. There's a big difference between the two.
Sure.
But so the contact, therefore, for me became a little bit of, I don't mind it. It's okay. You'll get hit, but you still have very good control over your body. Football taught me that. Not to mention, strength training in football is a lot more dominant.
Sure.
So, like you said, I think perfect athletes play American football. Those are perfect athletes.
Sure. Sure.
They're strong, they're fast, they're agile, they're quick. And they're able to read a very, very large space in comparison to, let's say, courts. The field is a lot bigger than the court. So it plays on a lot of different modalities that your body is accustomed to. Plus, it also uses significant amount of or a significant difference between the energy systems that your body produces, whether you're sprinting versus you are kind of running. You're in zone 2 or zone 1 cardio all the way to zone 5. So it fluctuates. So yeah, I
Sure.
found it very helpful.
Now, the other question would be, which is very significant about your basketball career, and I think it's significant to most pro basketball players, the topic of injury.
Yeah.
And we're talking about an injury that will limit you as a pro athlete. And I like to focus on there's so many aspects to getting injured as a pro athlete. The goals that you have in your mind, the objectives you have in your life. And I think it teaches you so much about, almost like American football or any kind of any kind of sport that we're talking about, right? Like team sport. I think they're life events. And I think as a pro basketball player, if you go through an injury that is limiting you, it will really change the course of your life.
Right.
And I like to focus on that with you because I know you have a story to tell, and I know you have talked about this story, but I want to kind of see what your overview of that injury is.
Right.
How did that limit you, and what did that teach you in life?
Oh man.
It's it's going to be a long conversation, but I like to hear.
That's a deep question. I like it. Look, when you ask a person once they get injured versus after they've completed their rehab and they came back to a sport, they're two different people. When you're in the rut is very different than when you're out of it. Especially if you've had a significant injury. And by significant, I mean it needed a surgical intervention.
Sure.
It changes you. It rewires your brain in a bit. I mean...
What was your injury, by the way?
I didn't have it in college. I had it after retiring from professional basketball. It was an ACL. In college, I actually tore my shoulder, where I needed a full-on surgery to reconstruct my shoulder.
Was it a slap tear or do you know what the injury was?
I tore my rotator cuff. I tore all the muscles around it, dislocated the shoulder girdle,
Sure.
and had a slight fracture in the back.
Got it.
Yeah.
Okay.
So that was the first, let's say, significant injury that I've had. And I was in university. My whole season was over. I had to sit down and focus on the books. But it taught me a lot. I was very physically dominant with my right hand. All of a sudden, I had to learn life with the left. When I look back at it now, it was my first experience of the slaps that we get in life. You know, something will happen that will kind of change the way you look at things.
Could it be a nice tackle?
Yeah, I don't know
Like
if
a
it
big
was
tackle.
that nice at the time, but
It feels like it, right?
It feels, yeah. That now, when you look at it in hindsight, sure, but at the time it was scary because look, anybody that goes through sports that has an aim to become a professional athlete, their psychology is a bit different. Their identification with the self becomes solely hinging on the identity that they carry on a field or on a court. So when these things come to a hold, you forget that you are much more than just an athlete. You're a full-on human being. It becomes this thing where you are like, who am I outside of this? Do I even matter? Do I have an identity? So it's a humbling experience if you let the ego take a beating. You're gonna humble yourself, and you're gonna look at yourself holistically. You are far more than just a body. You are far more than just your emotions. You are far more than, the aches and pains and struggles that you're going with. So you get to, in a way, it's like life is forcing you to get to know yourself a little bit better. That's if you use it correctly. Now, we could fall into depression. We could fall into anxiety. We can develop trauma. We can develop PTSD, post-traumatic stress disorder. All of these things may happen, and with the majority, they do. It all depends on you as a person, the people that are in your corner, whoever's taking care of your physical injury, and some people are lucky to have a sports psychologist that will help them through it. The rest might not be as lucky. So it depends on how you bounce back. How do you look at yourself when you're going through that?
Which one was more significant, the knee injury or the shoulder injury?
Oh, man. So
which impacted you the most?
I think the ACL, because it happened at a later stage of my life.
What year was that?
This was 8 years ago. So I had just moved.
How did it happen?
I was going up for a layup. We were playing with a couple of friends of mine, and I crossed over from right to left, and I tried to get up at the same time, and something buckled. It didn't feel right, and it was a sensation I've never felt before in my legs.
So really quick, this is a really interesting fact, and I think obviously you're an expert in ACL and knee injuries, and I would say you're one of the only people that I know that knows about, and I could be courageous to say you know more about the knee structures and specific terminologies, pathologies that exist with the knee. I could say around me. And I know a lot of orthopedists, and I know a lot of surgeons, and I know a lot of doctors. With all due respect to everyone, this guy knows his stuff, okay? Not more, but he knows his stuff. But I would say 70% of ACL injuries is non-contact.
Yeah.
And what that means is that the ACL just tears for no reason.
Right.
And it's so scary because everyone thinks the ACL is some kind of someone pushed you, or like someone tackled you, and
or
in
you landed
basketball,
wrong.
you landed. Sometimes it could just happen during practice. I've heard so many stories where people are at the beach, even not even pro sport. Like you're at the beach, you're
just having a life moment.
You're just walking, and then you just twist your ankle, and then the knee just kind of goes out. And I think it's a terrible. I mean, I've never had the experience so far, but from the athletes that I work with in the past, I think there are several stages that everybody goes through. Number one is denial. You think the ACL, you hear a big pop. Obviously, this is a significant sound.
I didn't hear mine.
You didn't hear a pop.
No.
Nothing.
It was so weird.
You didn't feel a snap.
No.
Nothing.
My kneecap, I felt like my kneecap moved.
Right.
Something moved.
Yeah.
And it didn't happen on a landing either.
Mhm.
It was literally going right to left and trying to jump.
Like a
with
step
my,
and then.
and a step. And it was just, I felt it just shift. And I said, what on earth?
Was it a
that?
full on tear?
Apparently, that's what the MRI said.
Any meniscal injuries with it too?
I think so. I think there was a little bit of
Okay.
of some work done on the
And
meniscus.
so that happened, non-contact, and you went and got an MRI right away, or
No,
you waited a little bit?
At first, because I was able to walk, it was a bit difficult to digest because there's this sudden foreign movement that my body has never done before, and a weird feeling that I've never experienced in my life. And I was able to walk. Went to the emergency. In the emergency, they tested it in such a weird way. And
This
then
is in
said,
Saudi or Canada?
No, this is here.
This is here in Dubai.
This is 3 years after I moved to Dubai.
Okay.
And he said, no, there's nothing wrong with your knee. Obviously, it was swollen. So it took me a while to kind of, okay, is something off? Is it good? Is it not? And then I started dabbling with my own set of workouts, trying to figure it out. At one point, I did visit a physiotherapist, and I passed every protocol for an ACL tear, and they had ruled out there is no way it's torn.
So what do you mean by protocol? I mean, orthopedic exams, like
Yes.
Lockman's test, anterior posterior jaw test, negative. Everything, your knee's stable, and
I was doing step ups, I was doing side jumps, I was doing it all.
Good.
Then they said, you're back to playing basketball. I said, all right. Got back on the court. Everything's going good. I think it was in one of the leagues that we have here in the UAE, in Dubai. And again, I changed direction. I remember actually, I had a behind the back move with a dribble, and then I got up for a jump shot. Same thing. As soon as I tried to jump, this time my knee really completely buckled. And I said, okay, there's something really, really wrong.
When you say buckled, what do you mean by that? Like, tell me.
It moved.
So you felt the shift.
Yes. So when you go from a straight leg situation, all of a sudden my kneecap just kind of like
moved a little bit. All right.
And I said, okay, there's something really wrong with my knee.
Right.
Went back, got an MRI. And they said complete rupture of the ACL. And I said, okay. Took that MRI. Tried to find another. Try to get another opinion, second opinion. Once they did the Lockman test, they're like, yeah, that's a complete tear. So you got two options. Either you can rehab again, just like you were earlier, which was fine. You were pretty strong and the knee was very stable, and you could get back to it, but it might do what it does again, depending on the level that you're trying to play. Or you're gonna have to do a surgery. So luckily, I got two good doctors and professors that did my surgery, so I was really happy with that. Right.
And I know your experience with the whole journey of ACL, and that you have some amazing people in your past. So we get to this point where me and you met.
Yeah.
In 2021, I think.
Yeah.
Right? Or 2022, in the midst of COVID.
Yeah, it was 2021.
Right? Okay. Through a great common friend of mine, Rami. If Rami's watching this.
Shout out to Rami.
Because honestly, Rami, I think, introduced the most amazing person in my life for so many reasons. And I think when I met you, we had a long conversation on the phone, because my friend, he was my roommate back in college almost 20 years 20 years ago. And when I moved to Dubai, he's like, okay, I want to introduce you to this guy. And you guys have a lot of stuff in common. So here's his contact, call him.
That's exactly what he said to me.
So, and he didn't say anything else.
Yeah.
So anyway, we met, and right away, I think my story started with our conversation on the phone, where you explained that there was a physiotherapist in your life that helped you with your
Steph.
your Steph.
Shout out Steph.
Right.
Steph.
And that story to me is very
Steph.
significant, because you heard my story. Like when I talked to you, we talked about your ACL, and then you said, by the way, I had a physio back in Canada, right?
No,
She's in Canada?
Steph. No. Steph is in the States. Steph is in
States.
Boston. Her name is Steph Allen. She's great.
ACL specialist, rehab, right?
She's dedicated her entire life for ACL injuries, and she was my online therapist.
Yeah.
And
she helped you throughout the process.
Oh man, Steph is great.
Yeah.
She's very knowledgeable. She was a former basketball player, former basketball star, and she was she was working at a clinic, and the obsession that she has with trying to help people get over an ACL injury, that's what kind of made me feel very, very secure with the decision of working with her.
Right.
And I've learned a lot from her.
Yeah. So the part that you mentioned, I think, is very important, because when you search as, do chiropractors help with ACL rehab? And the answer you'll get is yes, they do help, but they're not the main people behind the ACL rehab. Now, if you are a sports physician like myself, like where you specialized in chiropractic, sports rehab, physio, you actually have had many cases of ACL rehab. And I've worked with many teams that, because I think what happens with an event like yourself, you need a team of
100%.
people to help you. You mentioned sports psychologist. We need an orthopedic surgeon, obviously, do your surgery. The orthopedic surgeon needs to be intact with the rehab specialist. And I'm going to avoid the name physios.
Right.
Because what happens is the industry has this misconception of, when you have the ortho is going to have surgery, the ortho never meets the rehab specialist. Right. And then you just take your prescription to any physiotherapy department. Yeah. I need a knee rehab, and then they just give you 20 sessions.
It works in silos, yeah.
Right? And then I think what happens, there's a disconnection of surgical procedure, the patient, and the rehab team. And I think what happens is, on the prescription it says something very common: TENS, IR, ultrasound, therapeutic exercises. These 4 things
and
are
ice.
And ice. Or sometimes they put rice.
Right.
Which now we know rice doesn't really do anything unless if it's an acute injury. But anyway, let's say you had 20 sessions of physiotherapy, and your orthopedic surgeon is not in touch with you or with the team.
Right.
They will just say, okay, I'll see you in 3 months.
Right.
And I think the gap really exists like this, where if you see someone who is not a healer in this process, and if you don't talk to someone who is, I would say, a life coach or sports psychologist, you will go into a dark place.
Yeah.
And that dark place is, for a pro athlete, is a pretty bad place, because you're at the peak of your career, everything's going well, and you did not expect this event to happen to you, and there is no path. Like, if you go to your orthopedic surgeon, he would just advise you, just go to your physio.
Yeah.
You tell your physio, I still have knee pain, go see your ortho.
Right.
Then your friends don't have an understanding of what you're doing. When are you coming back to play basketball?
A lonely place.
When are you playing basketball? Stop being a whiner. Yeah. All these things.
Right.
Now, that's where, for me, as a healer and a doctor, so you have to be a healer first. You have to understand psychology.
Yeah.
And you have to understand what people are going through, pro athlete, non-pro athlete. What are people going through when they are injured? if
Right.
they're active. If you're just a non-active person, let's say if you're just an average Joe who just walks from the couch to the TV, if you tear your ACL, it doesn't make that big of a difference in your life. Not
Right.
too much. But if you are a pro basketball player
Right.
and you have your knee injured
Right.
and you don't have a role model, you don't have a life coach, you don't have a psychologist, you don't have someone to talk to, then that team is just disconnected and you will carry all the weight
Yeah.
on your shoulders.
That's
And
it.
I want to hear your opinion on that.
No, I like the way you phrase it. It takes a team to kind of help you. The thing is, though, my knee injury was more significant to me as opposed to my shoulder injury. I think it had to do with age. I don't know. I started thinking about that not too long ago. The beauty of being young, and I'm not talking about physiologically, I'm talking about mentally or consciously. Whatever happens, you still want to get over it because there's something you want to keep doing. So this is just a hiccup in the road, on the road. The older you get with life's difficulties and you managing certain things and certain stresses, and if you're a very active person, sports becomes your therapy. You want to be active. This is where you kind of feel young again. This is where you get your imagination to be a little bit loose and it becomes like this beautiful escape haven, so to speak. So when you get injured, it's a lot more frustrating for you because you no longer have an outlet that you've enjoyed doing. So the effects of it, mentally or psychologically speaking, and emotionally, is a lot more adverse. Or to me, it was sports were always my escape.
Sure.
It's a place where I just kind of I developed this mindset where for 1 hour to 1 hour and 20 minutes, I'm completely disconnected from everything. And this is where I want to express myself. This is where I want to unleash my, let's say, frustrations. This is where I want to, explore my body in a certain way. It's a place where I completely am in a state of flow. It's my meditative, my form of meditation. When that was taken away, life was very difficult. Not to mention, there's something we don't speak about. When you have a significant injury, no matter what it was, that required surgery, you're all of a sudden launched into the unknown. You're in a void. Am I going to get back? Doubt starts creeping in. Will I ever feel normal again? This is fear all day, every day. So it starts chipping and eating away from you. You get to a point where it becomes this, you need to really be able to have someone around you that says, this does not define you. Will it get better? Sure, it can. It would. That depends also on you and the people that are around you, because emotionally, however you're emotionally charged, or psychologically speaking, whatever state that you're in, is going to add to either the inflammation of your body not responding, the fear, the tension, And this all happens subconsciously, so you're not even aware of it for the majority of the time. And it starts becoming this thing where you're like, can I do this? Can I not do this? Will I be able to? And it differs from a person to a person. That depends on their attachment with sports or with being active. So for me, the first and most important part, if I would go back in time, I would try to talk to someone who could understand it. I would try to kind of explore the sports psychology aspect of it. That would be my first go-to. Like you said, not every surgeon understands the rehab part, and that's a problem because they're treating it as a case. This is a knee, and I need to fix it. Well, sure. But do you know what this person most of the time likes to use their knees for? Do you understand their level of activity? Do you understand their attachment to sports? Can you look at this person with all the other aspects of self that they have? It's not just, let's say, Ruse the person, but you have Ruse the person, Ruse the basketball player, Ruse the paddle player, Ruse the husband. There are so many aspects to your personality. So when one of them is quote unquote ailing or is dead, how can I revive that person? I don't think surgeons use that. They're just like, no, this is a joint and I'm going to fix it. That's fine. If that's the case and that's the route that you want to take, I hope you have plan B, C, D, and E, where, okay, now I need to go see a physio. Does this physio understand what I want? I'm not trying to walk in the mall. I might want to run a marathon. I might want to play basketball, volleyball. I might want to compete in a strongman, competition. That physio needs to understand who you are as an athlete. They need to work with that. They don't. They're just going to treat that this is what's going to alleviate your pain, take the inflammation down, which is all fine and dandy. And I'm sure they're doing a superb job. I have no knock on that. But they're not addressing the person with all that they are. You do. Now, if I'm able to have a sports psychiatrist or psychologist, that's an added value. Now, sometimes, like you said, I love the word that you used. You said healer. You kind of encompass all of that because you need someone to hold your hand when you're like, listen, we just did a treatment. It will hurt you for the next 48 hours. You didn't do anything bad. Because the mind will be on hyper focus or hyper vigilance, where it's just literally analyzing every sensation that it experiences. So you're sort of constantly on high alert. Once you have somebody that explains that to you, listen, we're going to do those exercises. You might feel pain later on. Tomorrow you might not be able to walk very well. That doesn't mean you effed it up. No, that's just part of the process, and you just need to take it a day at a time. We don't have that here. I don't think a lot of people talk about that.
Right. So I want to connect this conversation to another interesting one because it opened up another chapter. I have to, when we're talking about basketball injuries, when we're talking about rehab, and we're talking about surgeries and all those things, and I think really, really have to talk about one person so significant, and that's Kobe Bryant.
The Mamba.
The Mamba, and we have to talk about the Mamba mentality, not so much about Kobe Bryant, but about Mamba mentality.
Right.
And I think as a rehab person, what Kobe has done for this industry, for this conversation, I think he opened up this sub industry or sub chapter. He opened up a new world of understanding what an injury is. And I think you have to connect this to Denzel Washington, because I love this guy. Denzel Washington always says, if I were to fall, I always fall forward.
Yeah, fall forward.
Never fall back.
Yeah.
Never fall back on anything. You always fall forward. And connect Denzel Washington to Mamba mentality, and that's when you're getting injured, yes, it's a dark place. But I think he opened up a chapter and giving people an insight, a wisdom of getting injured is not that important. Coming back from the injury is more important in life. And I think it gives you a purpose. And this purpose is what you need to recover. I think as the surgeon, the athlete, and the rehab team, they have to have this Mamba mentality. They have to have it. You are injured. Okay. You accept it. When are you going to accept it? When you accept it, then we fall forward. Okay. And we're not just going to fall forward. We're going to fall forward and we're going to get back up. And I think when you're getting back up, you know that the place that you're going to land is going to be a better place than falling backwards. Right? Because if you fall back, you fall back. But when you accept it, that's when you're, I think, at a when you get close to the Mamba mentality.
Right.
Mamba cried after his Achilles injury.
Of course.
Okay, he didn't cry in front of people because he said my wife and my kids are watching.
Right.
My fans are watching.
Yeah.
But I'm not gonna cry. But he walked.
Oh, you're gonna cry. Yeah.
You know, he walked,
Yeah.
and he had the free throw, and then people now are saying, all the kids are saying, I tore my Achilles and I couldn't walk.
Right.
How did he walk? And when people were trying to help him to go back in the locker room, he pretty much didn't want anyone to help him. But then he goes and cries. But I think when he accepted that he got the worst injury of his life, he wanted to get back up.
Right.
He wanted to fall forward, accept it, and then work his way back up into rehab.
Right.
And he took all the help that he wanted to get. And I think what he taught the world was not just sports injuries. That anything happens with you in life or anybody. Use the Mamba mentality. Stop feeling sorry for yourself and use the people that are positive. Stick to those people.
Right.
Get rid of all the negative people.
Yeah.
All right. It's simple to say, but it's very hard. And getting back from that injury should be the most important thing. And I think it kind of brings me back some memories when I used to work at the rehab facility in Los Angeles.
Yeah, you've seen them all.
I've seen all these, and I've seen like, for example, when people had nagging injuries and serious injuries.
Right.
And I think when they accepted that they had the worst injury, now it's like, I'm gonna work harder than you. Let's say I would see 4 ACL cases.
Right.
And they all pro basketball players from different schools. Maybe UCLA, maybe they were in the league, NBA, maybe they were not, D leagues, whatever, it doesn't matter.
Right.
4 people, they see each other in the center, in the rehab center. And then I think the key was, I'm gonna beat you in getting back up on track.
It's competitive. It's that competitive nature.
It's not about playing the game anymore.
No.
It's about, I'm gonna beat you in the ACL rehab.
Yeah.
I'm gonna work 10 times harder. And what's missing in today's the kids, when I see when they get injured, is that they have no sense of competition. They just like to wear Kobe's shoes.
Right.
They just like to wear his jersey.
Yeah.
But they don't understand his mentality and his subchapter that just opened up in the sports rehab and in life, that connect Denzel to Mamba mentality, fall forward, accept, and beat people to, getting back up on track. And then when you're back, you're going to land in a better place than what you are today. Yeah. Right. And it also brings back another case, which is Derrick Rose, for example. He also had an left-sided ACL.
He had 4 or 6. I can't remember.
The first one started, I think he had 3 major injuries.
Right.
But when I look, the only thing I was going to say about Derrick Rose, love the guy. He's a great player, amazing player. But when he got injured in 2007, I think.
I can't remember.
The first injury was 2007. We can check the left-sided ACL, gets back in 1 year, maybe less. The first game back, he gets his right meniscus as an injury, leaves the game, comes back. He has a orbital fracture. He had an elbow injury. He had multiple ankle sprains. But when I see him now, I don't really see that Mamba mentality in him now. I don't think he retired, and I think he didn't really talk about his injuries, but I think Mamba was like different. I think the path that he went through, he tried to influence others to fight when they're.
Oh, I get.
You see what I'm saying?
Yeah.
That legacy.
Yes. I mean, look, the Kobes of the world, let's just call them that, they will always look for an advantage in any way, shape, or form. Kobe was the first person to open everybody's eyes to PRP and stem cell regenerative methods. He dealt with a lot of knee issues. Was he vocal about his injury? Yes. But what separates Kobe from other people. People don't talk about the Phil Jacksons, the people that have instilled different type of mindsets in Jordan, in Kobe, in the rest. They're able to be present. Kobe was okay with feeling all his feelings. Like we talk about different stages of, let's say, an injury, the denial, the anger,
the grief.
Yeah,
Yeah.
different stages of grief. Because you're literally grieving an aspect of your personality. It's true. When we get into the point where I'm constantly obsessing, am I going to get back to being normal? Am I okay? You have still not allowed yourself to feel what you feel. Allow your heartbreak, allow your pain, allow your anger, allow your sadness. You need to feel it all. Not a lot of people are okay with that.
Mm-hmm.
The examples that you spoke of, I saw that in Derrick Rose actually. But we have to understand that they're two different people.
Mm-hmm.
Kobe's way of dealing with life is completely different than Derrick's. My way of dealing with life is different than you. I saw a person that didn't quit. For you to have more than 2 ACL surgeries is insane. Mm-hmm. Let alone stay in the league.
Of course, in the NBA.
In the NBA,
because that's
as
a tough
Derrick
league
Rose
to be in.
and drop 50. You know, that's not a walk in the park. Because every injury is going to take a whole lot of toll on your confidence in your body, your confidence in yourself, your confidence in your game. So it's, on the contrary, I find Derrick an embodiment of the Mamba mentality, but he's quiet. You know, you don't really hear much about Derrick. Kobe was the face of the NBA. You know, Derrick
He
was
liked
not.
to bully people too.
I don't know about that. Rest in peace. He pushed people, I think, to
Yeah,
greatness. But what we don't talk about is, or that Mamba mentality that you're speaking of, it's not about just willing yourself into something. It's accepting your vulnerability to be in a position where you can embody all these emotions, diving into the unknown. I have no idea if I'm going to get better. I genuinely have no idea. I don't know when this, let's say, dark road is going to end. When am I going to see the end of the light? No clue. But you accept yourself for being that vulnerable and just say, but I have no other option. I can either walk it or I'm going to be dragged through it. So even if I sulk, even if I'm upset, even if I'm angry, even if I'm frustrated, I still need to walk it. One step at a time, you start realizing you're a lot more than what you thought you were. Do you get what I'm saying? So it's really about just you kind of consciously taking a decision to trust life, trust whatever it is that you believe in, and most importantly, trust yourself. Is it always going to be sugar canes, candy canes, rainbows? No.
Right.
Will it pour a whole lot of shit? Yes. But it's just one day at a time. And what people don't understand, it's not a linear upward road. No, it's a roller coaster. You could be here today, down here tomorrow.
Setbacks
even in an
everything.
hour. You went and you ran and you felt a click. You lifted weights and you felt a pop and you can't move a certain shoulder, a certain joint or move in a certain direction. Are you going to sit and panic? Or are you just going to be like, okay, fuck it. Let me keep moving. And that's something that I got from you. That's something that I got from Steph. It's like I was so fixated on every sensation that I was feeling. Meanwhile, I had done my surgery a long time ago. You know, things have moved differently for me. But because of my attachment to everything that I thought I was very eager to understand every sensation, every feeling. And most of the time, it was always skewed towards the negative side. But then I'd have people like you, they would be like, you know what? Who cares? Keep going. Put a little bit of ice and move. I'll see you on Monday. You need people like that.
Yeah.
You get what I'm saying?
I need people like that.
You know?
You know?
Yeah.
I think so. It's a really, it takes us to the next topic. And I think, let's say as a person who went through a surgery, you rehabbed it. Let's say you have the mama mentality, you come back and you go back to your track and everything. I think what I'm really interested to know, even for myself, so I'm 41 years old and we're about the same age.
So I'm older than you, I think.
You are older, a little bit. Not at this, after 40, it doesn't matter.
It doesn't matter. Okay.
So we're at a time. I think it's really interesting because two different mindsets, right? You are the master of sports, performance, training, sports science, all these things. A person who went through all these major injuries.
You humble.
Now I'm just I would say I would be the expert in the healthcare aspect of this injury and rehab and all those things. I think what I want to ask is I want to start with myself. For example, what's really interesting to me, I was blessed at the age of 40. I decided that, okay, I worked with Karim Benzema. I worked with Dwight Howard. I worked with all these big name athletes or whatever in the industry, in the leagues. But I also treated thousands of normal individuals. When I say normal, means very just average people.
They don't do sports as a profession.
They don't do sports.
No, as a profession.
Yeah, exactly. They were just random, let's say grandmothers, grandfathers, uncles, aunts, And I realized, okay, I did this for almost 15, 20 years and it was a blessing. And at the age of 40, I had the opportunity to open up a clinic in Dubai, Beyond Rehab. And I was like, I need to think about my legacy.
Right.
And this legacy, I think, goes to so many athletes also have the same thing. Like, okay, I played pro ball. I did this. So now the next chapter, what is it going to be? And for me was like, okay, if I treated these big time athletes, that chapter is also closed. Maybe I'll work with another or few more pro ballers or pro FIFA players or whatever. It's cool, but I'm more interested in Beyond Rehab. Beyond Rehab was my legacy, and I'm trying to work on that legacy. It hasn't even started. And I think you also know how hard you have to work to get to know people in this town and how to connect the dots, I would say. And sometimes connecting the dots backwards, as Steve Jobs said. So it's a small town, but you have to work very hard to get to know people in the industry and get to know more people in your field. But I think for me, as a sports rehab doctor, Beyond Rehab was my creation to see where this chapter is going to go. Where it was treating patients, but then the name is Beyond. Rehab. You can go anywhere, right? And my question for you is, how would G see his legacy? You played pro basketball. You played pro football. You are an amazing sports trainer, sports performance trainer, coach, life coach, all these things. Where do you see yourself? How would you see how are you going to define your legacy from now on? For me, it's really interesting to know.
Okay. First, I'm not a life coach.
You could be a life
graduate. Second of all, how would I? That's a great question. Honestly, I said this a long time ago. I was young when I said this. If I ever wanted to be remembered for anything, is that somebody who added value into somebody's life in any capacity that I could ever have, whether it's being a friend, whether being a lover, whether being an athlete, whether being a coach, whether being someone who's sharing a moment with people where I could just just add value, leave a little bit of love, just a little bit of information that somebody could take with them.
What about career-wise? Be more specific with all the
Career as a legacy?
like where you see
I'm
yourself.
still I'm exploring. I can't tell you I am defined into something, and this is a learning that I've learned, because my whole life I was an athlete. I am, we have the word I am, and whatever follows after it, that's your declaration. So when you keep saying I am only this and this only, then I'm kind of closing all the doors for other things that I might be. Do I know what I want to leave behind other than a little bit of love for life and for the people that I've been around or crossed paths with? I don't know outside of that what I would leave. Am I exploring? Would I like to dabble into things? Absolutely. Do I know for a fact what they are? No. But if I am to put that all aside, because unfortunately, I've dealt with grief in the last few years, and the one thing I realized after my parents had passed and my grandma and few other people that I know, work-wise, but everybody remembers how you made them feel. And that to me would probably be something that I would carry to my heart. So if I am to leave a legacy, I hope people remember me as somebody that just showed a lot of love. That's it. Like that's I think that's more than enough for me, to be honest with you.
But I saw you, for example, being more specific. Like a month ago, we had a pro basketball player in our clinic, and you guys crossed paths. Maybe
Marco, shout out Showtime Marco.
Showtime. And I
Great dude.
really enjoyed
Great
G.
man.
I saw a different side of G. It was an amazing experience seeing you talking to a younger basketball player who is making a name for himself in the UAE and for his basketball career. And just a few conversations you had, I saw something in you, which was really interesting to me. And I see that with, for example, Roger Federer, right? Or Djokovic slowly is getting there too. And I love tennis, by the way. I think for pro athletes, the biggest legacy is that you know exactly, almost like you're traveling back in time.
Yeah.
You see a younger version of yourself, and you have the best information and the best protocol to give them.
Right.
With not like you just telling you, let me tell you, son, what you should do. But you can just say a few things that will hit this spot.
Yeah.
And I think what happened to him is also like you said a few words or sentences where I was like, man, you caught him with a few good tips, right? And he loved it. And I think, let's say, any pro athlete, when you went through this journey, you have a lot of you have a lot of weight. You have a lot of weight on the name G. That could be, you have to share your story, and you have to, not just your story, but you almost have this, you could be a mentor to these young basketball players that, or any athlete. Hey, this.
Right.
And, I could share that with you. It's a wisdom. Take it or leave it, right?
It's definitely a possibility.
Maybe you could be that person that he might need, or she in the future, whoever. You could be that person that you didn't have when you travel back in time, and then you could be that person
that walked.
It's just a suggestion.
Yeah.
I just saw something in you
I appreciate
where I never
that.
saw before with you, and that was like when you had a conversation with Showtime. I don't know. Maybe he disagrees, but
He's a great ball player, by the way.
He is.
He's a great ball player.
He's pretty fast.
He's pretty good.
Pretty good, and just sharing your experience with certain individuals, I think, not as a trainer, but just think about that. That's something that I see not as a friend. I saw something that day where I was like, man, work on that. You got to share your story with more people, people need to value who you are as a person
I
and
appreciate that.
as a professional. And man, I enjoyed my conversation with you today.
The pleasure was all mine.
It was I learned a lot, and I think we will have more more conversations in the future. Yeah, more conversation in the future. The ice is broken, and we know what we can talk about specifically. Okay?
Absolutely. I can't thank you enough for this hour. I truly enjoyed it.
Well,
I can't thank you enough for your interest in the different sides of what makes a person, because you've always had that, and that's something that I can, when you attributed the word healer to yourself, I fully believe you embody
humbly healer. Yeah. I hope I want to be a healer.
I know.
I never say that.
But you are. You've helped me. Well, you've helped me personally quite a bit. In regards to what you said that you saw different, it was just, I don't think there are there's a saying that I really, really like. It said, coincidence is just God's way of winking at you.
Mm-hmm.
So it never happens haphazardly. It's never, out of the blue. And sometimes whoever it is that is seeking something, including myself, we're going to bump into the people that may have walked that road before us, or may have just been through a little more than we have in a certain aspect. And they're able to kind of illuminate that path that we're on. Whether it's with ball players that I've seen at your clinic, or whether it's with people that I meet sometimes on the internet, people that I talk to or converse, by commenting on something, people that I deal with on day-to-day life, and people that come and see me as a strength and conditioning coach, especially that they're coming back from an injury. Because I've had the back situation, you knew that. I've had the knee, I've had the shoulder. It's not because I know more than somebody else. It's just I've been where you've been. I understand it. I understand when somebody else says, well, no, it's not supposed to feel that way. No, I felt that too. So it kind of gives me that little bit of an edge for me to be in a position where I have been there. And I hope I could give you or add value to you at that time that I didn't receive myself. Just to kind of make this path a little bit more enjoyable for you, or a little bit easier for you to do. So thank you. I appreciate
it, man.
you.
No, I appreciate you. Seriously. I think it was, we're going to have more conversations. This is just the start. And, I think life is just
the
about
Beyond Rehab series.
It could be beyond anything.
Beyond Rehab documents, documentaries.
We'll make it through, man.
Okay.
We'll make it through. And I think that's it. I think for me, the
you
most
should be
important.
Doing more of this, by the way.
Yeah.
I think you're the natural. You got
Thanks,
it.
man.
No
Thank
problem.
you. So, God bless you.
You too.
And we're gonna have future episodes. Okay, hopefully.